Yes, definitely. And I changed my mind pretty early on. So, one thing that became distinctively clear to me is that in clinical medicine, it's very much based on the individual patient experience versus in public health, you're focused on the population at large. And I wanted to make the biggest impact that I could possibly make. And to me, being able to serve the population was the biggest impact that I could have, that I could ever make. And that would be my goal. And that in other ways, I could still serve folks at the individual level, but it doesn't have to be through what I'm dedicating my most of my time to. So like a full-time job. I can give an example that I give back in that sense by mentoring. Like I have a few mentees that I have currently that are at the college level or graduate, also in graduate school now, some who were my college students when I was a professor. So that to me is a way that I'm able to give back at that individual level or when I have career consulting clients, but that most of my time is dedicated to projects and organizations that are serving populations, or at the population levels, I should say.
Welcome to Public Health Careers. In today's episode, you'll hear more about the importance of intentional networking, especially as someone of color or coming from a marginalized background. You'll learn more about being a futurist and the importance of envisioning a future for yourself while also enjoying the present and wanting to make a population level impact and the various ways you can do that in public health. And lastly, you'll hear a straight up fire guide for thinking about applying to public health programs that's going to be hugely beneficial for anyone that is thinking about applying to programs. Something that we did forget to mention is that Jesenia has a podcast called Cosmica Show, which can be found on all podcasting platforms, where she talks about designing your dream life while also appreciating the present. Be sure to hit that subscribe button to stay up to date with the show. If you could please leave a 5-star review and share us with someone who gets value from it, I would greatly appreciate that, as it helps the show get out to more people and helps other people discover what they can do in public health. And lastly, there's a link to support the Public Health Millennial by buying me a coffee below, or you can become a monthly supporter. Thank you and enjoy.
Hey, this is Jesenia. I am a multi-passionate creative, business owner, show host, and much more. And you're listening to Public Health Careers.
Today, we have someone who loves sharing experiences and life lessons to inspire others to manifest, visualize, and create action towards living their best dream life. She wears multiple hats as a business strategist, career coach, and public health expert, delivering high impact and future-focused strategies and solutions for organizations, business professionals, and entrepreneurs. Her superpower is her unique ability to synthesize her background in corporate strategy, futuring, and foresight, learning and organizational development, brand strategy, and higher education to deliver insights and results for clients to succeed in the accelerated unfolding future of this world. She conferred a bachelor's degree in epidemiology from the University of Rochester, then did a non-degree Master of Public Health courses at CUNY Graduate School of Public Health and Policy, then got a Master of Public Health degree at Tulane University School of Public Health and Tropical Medicine. She currently works as a founder and CEO of Cosmica Consulting, a strategic healthcare strategy firm serving as an operations expert, monitoring and evaluation specialist, and business consultant, delivering high-impact solutions for organizations, business professionals, and entrepreneurs. She's also a health policy strategy manager for an evidence-based policy organization. We have Jesenia Angeles. How are you doing? Welcome to the show.
Thank you for that one. I'm excited to be here.
As am I. I'm glad that we can find some time about what you're doing and the evolution of your career. How do you identify and how are you doing?
Yes, so I identify as a Dominican Latina, from New York City, born and raised in Washington Heights.
Okay, that's awesome. And where's Washington Heights for people that might know?
Yes. So Washington Heights is in Manhattan, in New York City, specifically in Uptown Manhattan.
Okay, well, thank you for sharing that. And I'm glad that you mentioned that. And what has that been like for you to move from New York to Florida?
So although I love New York City and I think it's the best city in the world, a lot of bias there. I do resonate with the beach so much more than city life. So I found myself slowly making my way all the way down to Florida. I moved to New Orleans first, then to Atlanta, and then finally to Miami. And I feel like I found the sweet spot between New York City and my other home, Dominican Republic.
Okay, that's beautiful to hear, and thank you for sharing that. I hope that you're preparing for the Florida summers, which are a lot of sun and a lot of rain.
Yes. Yeah.
So can you talk in the intro? I shared more about your superpower. Can you talk more about the superpower? And I also want to ask you about a question about like futuring and futurist. But we'll talk about that in a bit. Now, share about your superpower.
Yes, yes. So I think if I had to summarize my superpower in short, it's my undeniable determination, which definitely ties into that futurist perspective and belief that I have. I wholeheartedly believe that we need to do things that make us happy, more of the things that make us happy. And by having that determination and knowing that it is possible to achieve the things that make you happy on a regular basis, on a daily basis, and not only when you go on vacation, I think that helps tremendously. I know it's helped me tremendously to know that I can set up a life that I don't feel like I have to vacation from, in short.
Yeah, I love that. I love that. And I think like that is like creating joy is an activity that we have to do. And there's so many things that are joyful in our lives. And I just to realize and be grateful for those things. So I appreciate you sharing that and like tying that into your futuring and futurist work or embodiment. First of all, you got to tell us what a futurist is, and then like tell us more about how you got into that and how that applies to your work in public health.
Yes, definitely. So I think a futurist to me is someone who is thinking about the future, of course, but still being present. So figuring out how can I get from here to there, and not living in a space where when you get something done, you're like, okay, on to the next one, but really appreciating like, wow, look, I'm living what once was my future. I want to admire this. I want to appreciate it. I want to enjoy it, especially when you've worked so hard to get there. I can go back to when I went to college, and I think it's important because this sort of deciding to go to college or deciding to go to a technical school, a trading school, whatever it may be, to further your education, further your training, improve your knowledge is really important. At the time, I was a trained professional singer at a very young age. So I knew what it was like to have to dedicate myself to something, to rehearse for hours for major concerts and performances, in New York City, sometimes in other states, sometimes abroad. And I had come to a crossroad where I also had a deep passion for science and for population health and wanted to pursue an education that would allow me to continue to explore music, but not so heavily as I had the majority of my life up until that point. So I ended up choosing the University of Rochester with the intention of doing pre-med. And shortly, like soon after I started my program, pre-med classes, I'm in biology, and I realized like this is not something that I would want to indulge in every day. So I'm thinking about the future. That's where that futurist in me can be present most of the time. And I think it's a very realist conversation that we have to have with ourselves, and that I've had many times ever since that college moment. And I just had to ask myself, well, if you don't want to do this, what would you want to do instead? What would bring you joy, more joy than what you feel right now, and that you would want to embrace on a daily basis? And I just felt this deep calling for population health, especially being Dominican and seeing the disparities that were much more present in the Dominican Republic in regards to health inequities. And I always wondered, like, why is it that they deal with more infectious diseases than we do, et cetera, et cetera? And that's what called me over to epidemiology. And I fell into that space. Once I learned about epidemiology, I was like, okay, well, what can I do with this? What is required for me to practice as an epidemiologist? And soon after, I found out I needed a Master of Public Health, an MPH. And I learned about the different positions I could have, that I could work as a public health scientist, a health advisor. I can work internationally, including the Dominican Republic. So when it came down to applying for graduate programs, which was a process within itself, I was very clear about what it was that I wanted from a graduate program, and how that aligned with my future goals of practicing international health, global health, public health. And a lot of things have occurred since then, since I graduated, which included those moves. I moved to New Orleans for graduate school, so that was a great opportunity for myself. And then I moved to Atlanta to work with Trinidad Enterprises / the CDC. So great opportunities. And I can talk about more how I first saw, choosing my graduate school as an opportunity, because I knew I would never move to New Orleans otherwise, and that I would definitely move to Atlanta because I just knew that I would work at the CDC. I was very determined to make it happen, or that I would work somewhere else, but I could move to Atlanta, given that it's such a big public health hub. So I'll stop there for now.
Yeah. Thank you, and that definitely helps us get a picture of like what that initial thought of like futurist, and just like, and I like the perspective of you just saying it is not only thinking about the future, but understanding that we are thinking about the future all the time, and a lot of times we are then living in the present that was the future that was our past, if that makes sense to
Yes,
people that are listening.
it does. It does. Definitely does.
Right. And I think that's important, because it's hard a lot of times to like just say, okay, that was a win, and move on, and not appreciate what it took to get there, and what it took to get through, and what are those struggles and all that life that happened during that time. So I'm glad that you mentioned all of that. Yeah. And I also forgot to give you the chance to introduce yourself in Spanish if you'd like to. I typically give people that opportunity if they'd want to.
Thank you. So, saludos, yo soy Jesenia Angeles, soy una epidemióloga y también trabajo en policies, específicamente en el tema de salud, y estoy entrenada en epidemiología, en salud pública, y ahora mismo trabajo en la zona de policy, y también tengo mi propio negocio, a donde trabajo con otras compañías, ayudándolo con la evaluación de sus programas y proyectos.
Muchas gracias. I would not pretend like I know everything you said, but I appreciate you sharing, and I'm glad. I'm sure that other people appreciate everything you shared. And I know, like what you said in your previous answer around, you found out what you can do in public health. I'm glad that you're on this show right now to share your path and your thought process, because it's going to help a lot of other people figure out their path. So Absolutely. Before we get into your bachelor's degree, what does public health mean to you?
Yo, are you looking for an online community to connect with like-minded health-focused people? Join my free community health and wellness Discord server at thephmillennial.com/join. You'll find growth-focused people talking about important community and personal health topics, networking opportunities, online yoga, book clubs, and more. Be sure to introduce yourself when you join. Link is in the description. Now really, back to the show.
This is such a great question. A lot of the times when I think about public health, I always think about service to others. And I tend to lean towards health, but in all honesty, I believe that health isn't everything. Health has to do with, when you're in a car and you see stop signs, that was part of a public health movement. Other environmental factors, how we have protection, so people in some states and places, you can't smoke cigarettes in your homes. So it doesn't affect others and their health. I mean, it's everywhere. So to me, I feel like public health is serving other people, and also addressing the inequities that exist in being able to be healthy, like your most optimal health. I think that's a part that is really important to me, that I'm serving those communities that need it the most right now.
All right, and I think well, first of all, thank you for sharing that, and I think in that like that vein of health equity and understanding, like if we save the people who need it the most, other people are gonna get saved as well, while we're doing it, but like making sure that we are focusing on those people that need it the most, so that they are not the ones that are left behind is important, and like basic premise in health equity.
Yeah, I think that we want to prioritize them, but still make progress for other folks that would benefit, from healthcare services or whatever it may be. And I think our approach during COVID, like with, for example, the vaccination schedule, how it went out to people that were most at risk to having negative outcomes if they were to become infected with the COVID-19 virus. That was an example of us still making progress and trying to get that vaccine to everyone, but that these particular populations really need it first because they're more likely to die than someone who's like very healthy, although it is still possible.
Right. Exactly. And that's a good tangible example for people to understand that's real up there. Okay, so you told us a little bit about you got your bachelor's degree in epidemiology at University of Rochester. You told us going into this you wanted to become a physician or be in the medical field. So what kind of like changed your mind? And I know you spoke a little bit about it earlier, but can you just talk more about like that thought process a little bit more, and then like what changed your mind while you were in your bachelor's program?
Yes, definitely. And I changed my mind pretty early on. So one thing that became distinctively clear to me is that in clinical medicine, it's very much based on the individual patient experience versus in public health, you're focused on the population at large. And I wanted to make the biggest impact that I could possibly make. And to me, being able to serve the population was the biggest impact that I could have, that I could ever make. And that would be my goal. And that in other ways, I could still serve folks at the individual level, but it doesn't have to be through what I'm dedicating most of my time to. So like a full-time job. I can give an example that I give back in that sense by mentoring. Like I have a few mentees that I have currently that are at the college level or graduate, also in graduate school now, some who were my college students when I was a professor. So that to me is a way that I'm able to give back at that individual level or when I have career consulting clients, but that most of my time is dedicated to projects and organizations that are serving populations or at the population levels, I should say.
Yeah, you just put words to something that like I've thought about, and I think it's the same framing, maybe different framing for me. Is like I went into my MPH program still wanting to become a physician, but then realized that there were these systemic issues that I wouldn't be able to solve in a clinical setting. So I would, even if I did become a physician, I knew that in the long run, I wouldn't want to be in that clinical setting one-on-one for a long time. So just that value proposition just didn't make sense for me to continue to want to become a physician when, as you said, you impact populations.
Yes, exactly.
And you're more likely to get to the root causes of the issues that are sending people to the healthcare system in the first place, which is only 15% of your health. And as you mentioned, those other things, right?
Yes, it's all connected, and working together is critical for us to make progress, whether that's in the clinical, one-on-one patient space or in public health in the population.
Absolutely. And even to that point of like partnerships, if we think about who has the funding, it's health systems who has a lot of the money. So how can we partner with health systems to actually improve the health of populations? And that's like the $1 billion question, maybe $1 trillion question out there. Anyway, so when you were in your bachelor's program, you got some MPH courses needed to complete your bachelor's in epidemiology. So tell me a little bit about that.
Yes, so I had a very unique experience when I was an undergrad where the majority of my epidemiology courses were at the University of Rochester's medical school, and I would take them as part of their Master of Public Health courses. So the majority of the program consisted of MPH students and then some MDs and other folks in the clinical space that wanted to learn about epidemiology, a specific area of epidemiology. So I spent like 3 years going to 2 universities, essentially, which was very challenging, very difficult, but also extremely rewarding because I had the opportunity to take so many master's degree courses. It gave me great insight into what a master's degree program is because I was essentially part of one. And it allowed me to tailor my experience once I did get to my MPH program. I also opened up many, many, many doors because I learned so much technical information and had gained so much experience, even just secondhand experience, being surrounded by folks that were practicing for 20 years, 15, 25 in the same space as me, really, really helped me to get to a point where I felt like I had learned a significant amount by the time I graduated that's comparable to folks that are in their first year of their MPH program.
That's real, and I don't envy the part of you like having to go to 2 schools and whatever stress came with that. But I think the value of you being able to get exposed to public health, and especially like higher level classes, to really understand what this is, and as you said, like be around people who are doing this work to kind of like let their skill sets rub off on you and just understand real life practicing public health. I think is so valuable.
Yes, so I can add that when I was in my MPH program, because of that experience that I had, I was able to waive certain classes. I took courses that were much more technical. I was taking biostatistics, like advanced biostatistics, and just really honing in on my coding skills, because I knew that would be a valuable skill set to have in the workforce. And then I also got to take doctoral classes as well, because I didn't have more master classes to choose from. But also at the same time, I wanted to take doctoral courses because I was interested in possibly pursuing my studies, but also just wanted to gain like the most advanced skills that I could. I mean, these degrees are not cheap, and I wanted to make sure I was making the best out of it. So the most I could learn was definitely my goal. Like the more I could learn was definitely my goal.
That is straight facts. So yeah, it definitely is not cheap, and it's an investment, and it's your money that you're spending. So you take as much advantage of all the opportunities that you're able to.
And I definitely account a lot of my success in my graduate program, the opportunities I had, including taking those like doctoral courses, to my graduate advisor, who is Catherine Angeles. She's still working there. She was a phenomenal mentor to me and always supported me with the goals that I had, and the futurist in me, and wanting to do more than what my peers were doing at the time, or what was the norm. And I really, really appreciated having her support and believing in me and supporting me with those endeavors of wanting to like further my education, even more than what was expected or what was listed in a general MPH curriculum.
Right. Shout out to Catherine and others like her out there. And talking about like just using opportunities while you're in your bachelor's program, you're able to study abroad in the program. And I believe you went to the University of Oxford, overseas study, IES Health, Practice and Policy Program, Public Health Studies, Epidemiology. Do you want to share more about that experience?
Yes, I love that experience. And, it's 10 years ago now, because we're in 2023 and that was in 2013. That experience definitely instilled the travel bug in me. That's number one. And number two, it gave me so many opportunities. So this particular program, and I almost didn't do it. I guess I should talk about that. I was like obsessed with the idea of going to Australia, like the other side of the world. The only other place I had been to was really the Dominican Republic, and then Switzerland when I was singing. But I hadn't really spent that much time anywhere else. So when it came, because I was in this unique epidemiology BA program, I didn't have the option to just pick any program for my undergrad, because technically I could, but the courses wouldn't count towards my coursework because they didn't match the caliber of a graduate course, because they're undergraduate study abroad programs. So I was limited in terms of the number, what types of programs I could apply to. And this London program seemed like a really great fit, because as a singer, I'm like super connected with the arts, and London is very well known for the arts. And I would have the opportunity to study theater. And that was really important to me, to still continue, which is what I was doing when I was in undergrad, like taking certain courses, performing. It was really important for me to still dip into that passion of mine. Like I mentioned when I first started, I'm multi-passionate, multi-entrepreneur. So it's important for me to feed all these aspects that make up who I am. So this program I studied at, it was through IES abroad. And I studied in the city of London, and then I also studied at the University of Oxford, which was an incredible experience. I definitely can attest that they're the best university in the world. Their approach to teaching and learning is unlike anything I've ever experienced or heard other folks experience outside of that university. And it really changed the way I thought, like how I approached critical analysis and thinking and problem solving. I remember my commute to class, like to Oxford, was like 2.5 hours. We would wake up at like 4 something in the morning. By 5, We're out in the streets, going to the train, running to catch the long distance train. And it's very dramatic, just like you can imagine in movies, but I would never change it for the world. After I did that, like 5-hour commute in a day, that was my last class on Fridays. I would then take another train to the airport and start my journey to another country for the weekend and come back in time for my class on Monday. So it was a really great experience. When I was working in London, I also worked at a center that served individuals that were houseless. And that was also a phenomenal experience. So I had an internship while I was there. And yeah, ever since then, like working with folks in that position, which can be incredibly difficult, that are facing inequities, that are really hard to have to deal with. It really opened up my eyes to this passion and desire to work in international health. And that's what led me to apply for an international health and development degree for my graduate master's in public health.
Awesome. There was a lot in that.
Yeah.
And yeah, I guess the first question that I want to ask is, what is your favorite place that you've traveled to?
Ever or during that trip?
Ever.
Okay. Well, ever, I would say, is Thailand. I've been there twice. I just came back from a trip in January, and we're recording this in March. And the first time I went was a few years after that London, living in London for several months and traveling all over Europe. And I realized, like, oh man, I wish I would have had time to fly to Asia. Of course, not easy to do over a weekend, so it wasn't feasible for me at the time. Right. But yeah, it's been my favorite place so far, and I can't wait to go back. I'm planning to go back, hopefully, later this year.
Okay. Well, thanks for sharing that. And I think like just to highlight how dope that is, because that's one thing I think people don't realize. When you get to Europe, it's pretty easy to travel around Europe and decently affordable to do so. So that's awesome that you use that.
Yes, I did work really hard to get scholarships and funding for my Euro trip. And I also, before I left, I worked like part-time jobs and tried to save as much, but I definitely made far less than what I make now. And it was still very feasible and possible if you plan for it and you structure around that. And I think it's a really important experience for anyone that's out there at a university. There's so many funding opportunities available for you to study abroad. And oftentimes it's actually cheaper to go to another university for a semester because their tuition is far cheaper than in the States. I went to a private university for my undergrad, but I was on scholarship there. And it was still cheaper at the end of the day, which helps because sometimes you get a refund and you can use that money for when you're abroad. So there's always a way. If there's a will, there's a way. I strongly believe in that.
Yeah, so get your will and you'll figure it out. You'll figure out that way.
Yeah.
And I guess I should ask also, what's that favorite place that you traveled to on that trip as well?
My favorite place was probably Portugal because I went to this city called Faro. I still haven't been to the capital of Portugal, and I've been twice. But they're always last minute random trips. And this one I bought my ticket maybe 48 hours before, 72 hours max before I left. And I went on Skyscanner and I ordered it from cheapest to most expensive, and I picked the first place that was the cheapest, and that was that city. And I went, and it was it's a beach city, which warms my heart because I'm a beach girl. And yeah, it was such a phenomenal experience. The culture, the people, and I did have the opportunity to ask around like about people's health experiences and just their lived experiences in general. And that was really insightful. Like, it just showed me that there's so many different ways to live and to approach life. And for me, that's always been really inspiring. That's my favorite part of traveling, is learning people's life stories. Like, how did you and I get to this point where we're both talking right now? Like, what's your story?
That's important. And I think like it highlights that, because I think that's a huge part of the public health puzzle, just being able to understand like life and like how we live it here in this one place and how people perceive what life and happiness and health is in another place. And there's just so many different ways that we can live healthy, happy lives, and just understanding that. So yeah, that's awesome. Thanks for sharing.
Of course.
Now Yeah. Now getting back to more public health stuff, but more public health stuff. So after you graduated with your bachelor's, you got non-degree MPH courses at CUNY Graduate School of Public Health and Health Policy. Was that afterwards? Am I correct in saying that?
Yeah. So I took some courses there while I was working to enhance and strengthen my application for graduate school. Mm-hmm.
Okay, so at that point, you knew that you were planning to go to graduate school.
Yes, I was. So I wanted to take certain courses that I felt like I could have aced if I was in undergrad, not attending 2 universities, not working 3 jobs and whatnot. Right. So I took some courses that were challenging, but because I wasn't taking a full load, I remember I took 2 courses at the same time while I was working full time, and it was just so easy for me to focus and get the work done. And I understood the material. I was really familiar with it. And it was 2 easy A's at that point because I didn't have as much on my plate. So, and I was older, you learn a lot once you get through 4 years of undergrad.
Yeah. Shout out to you though. And yeah. Okay, so you were working as a program manager, senior clinical research coordinator at Mount Sinai Health System at that time. So how do you come across that position, and what do you do while you're doing these other non-degree CUNY courses?
Yes, definitely. So I can backtrack. After when I graduated from undergrad, I got a job as a clinical researcher, and I worked in cancer research. I worked on stage 4 lung cancer patients and on clinical trials where we were testing drugs that would help to provide a better quality of life to patients that were stage 4 cancer patients. And it was an incredible experience. It was very high urgency, I really felt the meaning of saving people's lives. And once I had worked in that space for a while, I had the time to sort of revisit, do I want to go to med school? Even though I had already been past that point. But I remember working there and thinking, wow, I wish I could do something that's at a larger level for these patients. That would improve their quality of life. And that's when I decided okay, I think I need to hone in and make sure that my next step is really in public health. So that's when I ended up at Mount Sinai working there. And the project that I worked on, it was really close to home because it was based on serving pre-diabetic adolescents ages 13 to 19 years old in East Harlem, a very similar community to which I can relate to growing up in Washington Heights, who faced large health disparities when it came to race and ethnicity. So we had, when you would compare children that were Black, Latino, and other races with white, with folks that identify as white, the gaps in those that were diagnosed with prediabetes was far higher than for folks who identify as being white. So for me, that was really important. I wanted to be able to focus on racial and ethnic disparities, and I didn't have that in the previous job. And that's really what led me to be in that space where I was working with a bunch of different community centers, also hospitals, partnering with multiple stakeholders, making sure that I could get buy-in and understand, expressing why this work was so important. And just to give some background, the work that I was doing was providing a education, a curriculum for the students to go through, where they would learn about nutrition and peer pressure and family and everybody who impacts your overall health, as well as providing opportunities to learn about exercise and exercising together and having peer support. And this course was made by the lead investigator, who is Dr. Nita Vanjipuram, another phenomenal mentor of mine that I've had. And it was really important for her to center adolescents within their own care and development of improving their health. So those courses were actually taught by peer leaders. And it was cool because when certain peers went through the program, they had the opportunity to then train and become peer leaders themselves. And then they can directly relate to the folks that their other younger peers that are maybe going through that program and having the same issues and young teenage adolescent crises that you go through. So it was a phenomenal program, and it really opened my eyes. Like, wow, if I can do this work at this community level, imagine if I could do it at the state level or nationally or internationally. So I felt like it kept growing from there. And that experience really prepared me to be competitive for my graduate program. So I was also thinking about that, like when I was in the clinical research role, working in cancer care. This is a great program this is a great job if I want to go into clinical medicine, but not so much for public health. I mean, it relates, but it's not giving me that experience that I need. And when I was working at Mount Sinai within that role, I got to learn about NIH grants. I got to learn about other private funders and how that works. I got to build a community advisory board. I was a supervisor for interns and was a part of a recruiting process and hiring and whatnot. So that was, the experience was really beneficial for me, and it set me up for a lot of opportunities that came after that, including being able to start a graduate program and having multiple positions available to me, which is not the case a lot of the times, because they typically want you to go through a first year of MPH courses and like learn about public health. Not everybody has the opportunity to study public health in undergrad like I did, or work before their their MPH program like I did. So I was really thankful that I had thought about, like, when I go to graduate school, I'm definitely getting a job. How do I make sure I get a job? And I remember that to them, professors really wanted you to have experience working on a research study in public health. So I made sure I had that.
Yeah, I appreciate that. And I think it's really awesome that you're saying, like, I'm trying to be competitive for grad school here. And I feel like you're already competitive from your bachelor's degree. But like, to your point is like, how can I get exposed to as much as I can right now where I am to build and understand where I want to go next, as well as like give myself the most amount of opportunities when I get there. And that in itself is awesome. And like, it speaks to itself, because you said you're able to get a lot of positions during your MPH program. Okay, so you got your MPH you got your Master's of Public Health in International Health and Development at Tulane University School of Public Health and Tropical Medicine.
Yeah.
So tell us a little bit more about that thought process.
So I was extremely intentional, like I mentioned before, about what MPH program I was going to. So I refused to repeat like my undergraduate coursework, curriculum. And I wanted to make sure that the university I was going to for my master's offered opportunities that were different from what I had already had in the past. So I was looking for things like a certificate program. So I also obtained a monitoring and evaluation certificate, which is what I've actually focused my business on now and working with M&E clients now. I looked for opportunities to work abroad, especially during the practicum between your first and your second year in an MPH program. I looked at what were professors working in and making sure that there was a good handful of professors that had active work in global health. I looked at where were students working after they graduated from their public health program. I think those are all the things I looked at. Also, I want to mention, I approached my MPH application process very differently from most people that I've spoken to, or like what is the norm. I was very dead set on like obtaining a PhD, and I did try to do a combined MPH PhD program. I applied for those. So my approach was very different, even for programs that were just the MPH program, like the one that I ended up moving forward with. And I would arrange to speak with professors and interview them and like gain a better understanding of what's their research. I would review their papers before I got on calls. I would read as much as I can before I got on calls with them. I would write them a very thorough email introducing myself and like letting them know what I wanted to talk about. And then I would have this conversation with them so I could learn about what were their current grants that they had. Were there any needs that they were hoping to address? Maybe if they would have any research assistantships available within the next year or so, because I was applying a year in advance. I was doing this, reaching out to them a year in advance, since you have to apply, the fall before the next fall when you go in. when you're accepted and you start your program. And then I did the same thing with students as well. So I wanted to know, like, what were student experiences? Did they feel supported? Did they not? So I did a lot of homework, a lot. And I think, I mean, I learned over time, having had applied to MPH programs from the moment I was a senior in college up until I actually got in. So I applied like 3 cycles, and I say 3rd time's a charm. I think 3 is my lucky number, even though 2 is my favorite number. And, you know, that's to say that sometimes I think people don't know about like the struggles and like the hardships that sometimes we face. They see all the accomplishments. I've gotten that a lot for myself, and I'm like, yeah, but there's a lot that has happened in the background, such as that, like not being able to get into a program and figuring out like, okay, what is it that I'm doing wrong? Am I not good enough? Having all these imposter syndrome type of thoughts. But regardless of those thoughts, I've always been extremely determined. Like I'm not going to take no as an answer. Of course, respecting boundaries and whatnot. I have to drop that disclaimer. But yeah, I just worked really, really hard to find a program that really matched what I was interested in, what was important to me. And honestly, I ended up choosing my program. I remember like I had 2 universities. I was down to the wire. It was my top choices. Both universities were like just everything and anything I wanted. And I ended up going with Tulane because they would allow me to obtain a certificate. But the other university, they would choose the students that could get the certificate. And it was a very, very small number. And it didn't make a difference in tuition. So for me, that was really important because I felt that if I'm paying the same, I should be offered the same opportunities, such as obtaining a certificate if I want to put in extra work, because you have to take extra, you have to put in extra work to obtain a certificate. But yeah, that was ultimately what led me to choose that university over others. So a lot of research, a lot of thought, and that differs for everybody. My mentees ask me a lot about, oh my God, what do I do next? Do I work? Do I go to grad school? How do I choose? How do I know? And I'm like, same questions I had, but you got to start small, pick one thing and break it down up until you can get to like, what can I do today? And then tomorrow you can figure out, what am I going to do tomorrow?
Yeah, love that. And I'm so glad that you mentioned like that thought process and that process of what you went through thinking about applications, because like thinking about the professors' work and if they're doing global health work, and if there's not only just one professor, but if there are multiple professors doing global health work, if there's a practicum that you can do abroad, if what are the jobs that the students get from the program, what is the experience of the students in the program? And I think there was one other thing that I forgot to write down, but like just having that holistic, encompassing view of like, what am I getting from this? Like, and really asking that question. And to your point of like reaching out to professors and reading their papers beforehand so that you can be thoughtful in that email and that you can ask for those opportunities and be like more specific about it, I think is very, very important. And also important that you highlighted that like a lot of times people do only see our successes, or like we feel more comfortable to share our successes, so people do not know what the failures are or what that path has been there. And I think like back to the futurist perspective of being grateful for like what is now, because of all those things that passed that we mightn't have, like we're trying to actively forget them, but they are part of the journey that has led us to where we are today, and we have to be grateful for all of that.
Yes, absolutely.
Awesome. So while you were in your MPH program, you had an internship as an epidemiologist in disease surveillance analyst at the, I'm going to butcher this, Dirección General de Epidemiología at the Ministry of Health in Dominican Republic.
Yes. So to me, it was really important to try to work in the Dominican Republic because I'm Dominican and I wanted to give back to my community, like to my family. I mean, it was the whole reason why I was specifically interested in infectious diseases. That was the area I was seeking to become an expert in, and that I have since become an expert in. And so I very much worked extremely hard to get this internship. And I'll give the story of how I got this, which was very ironic. So I am a strong supporter of building as many connections as possible. And my friends, colleagues, anyone will tell you that I will tell you to join a Facebook group, a WhatsApp group, an Eventbrite, show up to, any meetups, like going to meetup.com or using their app, because networking is the most powerful thing that we can tap into, and it is free, like most of the time, or at least you can definitely find it for free. Right. Because of the communities I was raised in, the family that I came from, my parents are immigrants to this country. They came from the Dominican Republic when they were like in their late teens and whatnot. I don't have the connections in public health that maybe my other friends that have had the opportunity to grow up in affluent communities, or just to be more connected, because their parents and their parents' parents and their grandparents' parents have been building their careers and everything for themselves, which I think is great. Like, that's phenomenal. But it's also, even though we may not have it, instead of focusing on the negative aspect, as a person of color that doesn't have access to those networks, I'm going to work on building them, because I am determined to build my network. I'm determined to get these positions. So I used LinkedIn to connect with the Ministry of Public Health in the Dominican Republic. And at the same time, simultaneously, I was still trying to tap into my network of people and like set up other internships, because of course, like, I wasn't sure where I was going to end up. So I reached out to someone on LinkedIn that worked there and expressed my interest about, to serve in the Dominican Republic, my background being an epidemiologist. And I asked to like set up a call and like if they could connect me with the director of the division. And they did. They absolutely did. And I ended up having a phenomenal interview with her. And we came down to like, when are you going to be here? When can you start? Okay, this is what you're going to do. This is what you're going to help out with. And we can't wait to see you. And I'm like, what? Like, that's it? No more, nothing else? Like, and like of course I say that in the sense that like, I can't believe that I was able to connect with her, and that through this interview, which I prepared very intensively for, I was able to share with her and communicate all the skills I have, the experiences, what I can offer, what I'm looking to learn, the gaps that I may have, but that I know I can overcome with like some oversight, some guidance. I was able to share that with her and to illustrate to her, yeah, like this person who's young in her career could help us and could serve us, and in turn, we could serve her as well. Ironically, this is where the part comes in. Through my connections, I was working, one of my jobs was working on a USAID project, and the lead for that, she was working directly with them in Washington, D.C., but she would come and visit in New Orleans, and there were other professors on staff for this particular project. And I had mentioned to her, and so did my advisor, again, shout out to Catherine, that I was looking for an internship and that I wanted to work in Latin America, specifically with a preference for Dominican Republic. And she's like, okay, I'm going to see what I can do. I have colleagues there. And the same day that I like got offered the position, like she told me she would email me. My supervisor on this USAID project also gave me her contact and was like, hey, can you connect with her? Like, she can help you get this role. And I had to tell her like, oh wait, I already spoke to her. I have the job. So I thought that was so funny, because it was destiny. Like, it was meant for me to get it either through the avenue that I took or through the other networks. I mean, both of them were because of the energy and like the efforts that I was putting out there to say like, hey, I'm looking for this. I want this. This is what I can offer. Please help me. And trying to help myself as much as possible. So I love thinking back to that story and being like, yeah, I did that. I made it happen.
You absolutely did that. You put the energy out, you put the effort out, and like, shout out to you for like that double affirmation of yes, we want you as an intern, and then yes, let me connect you with this person who'd be great for this position. That is awesome, and that is awesome that you're able to like get that opportunity. And to that point, like, reach out to people on LinkedIn, because you never know who's willing to connect you to who.
Yeah, I will say all the jobs that I've had, I feel like, I think ever since then, but definitely my full-time jobs have always been through connections that I've learned about them or been recommended for. And I feel like I still put in a lot of work to apply. Like I go through the formal process, but most of the time I'm ending up with the jobs that came through a connection.
Right. And like going back to the point of networking and building your network, especially as a person of color, as someone who comes from a community that doesn't have, as you said, the connections and the history of those connections, just understanding that, like, regardless of if you do it now or if you don't do it, your life is going to happen. So if you really want to be in that position, to have those communities, to build those networks and have that kind of support, it's going to be on you to find those spaces where you're able to connect with people and make those network connections and build from there. And I think just listening to this and connecting with the guests connecting to the guests that are interviewed and share their stories on this podcast is a great way to start, and like reaching out to them and seeing how you can help them. And I think like one other thing that you highlighted is that you went to the interview over prepared. You went and you shared your value, and you also shared, okay, these are the things that I might need more support on. And they were in the same realm of understanding that we'll get all these things, and we can also support this person in their career development in these ways as well, which I think is a beautiful way to think of it. So be prepared.
I want to add that especially women or people that identify as women have a tendency to think that we need to have all of the experience that may be asked. So if you're looking at a job, I need to have every single thing that they're looking for, which is not true. Some of those things do have wiggle room, and being on the other side where I have been and am currently responsible for recruiting, for hiring, for reviewing applications, interviewing, all of that. There are certain things that, yes, we do not have the capacity to train on, but there are other things that we're like, yeah, we're okay if they're not an expert in that area, or if they don't have familiarity with it, because we know that specific area, content area is easy to learn, and you can learn it on the job. So I think jobs, when you're having that conversation, when you're interviewing, whether you're doing an informal interview or a formal interview, it's important to ask, like, is there anything that, from what I've shared that is concerning to you that I can help to clarify or address? And they can raise a flag, like, we noticed that you haven't worked for that long, so we're not really sure if you have the capacity to learn this whole new skill. And then that could be an opportunity for you to say, well, actually, I've been learning this on the side for months. I haven't worked in a professional setting for, let's say you're learning how to code, but you practice in R as much as possible, and that you do feel like you'd be able to work through the learning curve with support and training if they're able to assist with that, because it's a two-way street. Like what you mentioned before of me trying to get these opportunities, I always see it as a two-way street. Like, I'm trying to serve you, but I also want you to serve me, and we might not be in alignment, we might not be compatible, and that's totally okay. I'd rather know than start and pretend and lie and whatnot. But being that honest and transparent about what it is that you need, what it is that you want, and also allowing the other person on the other side to do the same with you, will set you up for success in anything, whether it's career related or not.
That's great advice. And like just giving that person the opportunity to share, like, what are the things that are concerning here? What are the red flags that you are seeing? And like giving yourself that time to address those things and say, well, yeah, but this, or yeah, but I'm doing this, as you said, is important. So yeah, thank you for sharing that. So you worked in a few jobs while you were at Tulane University. You were a graduate research assistant, office assistant, research assistant, as well as a monitoring and evaluation team lead and supervisor. Do you want to talk a little bit about those experiences?
Yeah, well, now that you said it, I'm like, wow, I did a lot at the same time. Oh my gosh. I was very strategic. I remember my office job required very little to nothing. I just had to be present, and if something was needed, sometimes we would host like grand rounds. Sometimes professors needed something printed for them. I had to check the mail, but I was assigned like 20 hours a week, and most of my time was not taken up by all of those tasks that I mentioned. But they are committed to sponsoring and hosting a student and giving them the opportunity to have work study and earn money, whether they have a lot of things for you to do or not. That's the benefit of having like this additional help or employee, is that they will be there to help you when you do need a lot of stuff. But they know sometimes there's not that much to do, but they're not going to take away that money that could be really critical and crucial for that student. So I really like that. I just wanted to mention that. So what I would do is that I also had research assistant roles where a lot of the work was independent. So conducting research on my own, and preparing for conversations to follow up with the professors/researchers that were lead investigators on these different research studies. So during my office job, I would work my other job, or just allocating time, around when, like before school and whatnot. But I just tried to be as strategic as possible with my time, because my jobs were flexible and like they understood that, yeah, I need to have, sometimes not all of my roles were paid for either. So that office assistant job could have been the one paying me. But then if I was doing like a short project or something, maybe I didn't get paid for that. So that was a way for me to not have to give up that opportunity. And then in terms of the Tulane lead, I took a lot of classes my first year. Like I overloaded my plate. So I think the average is like 4 classes, but I was taking 5 most of the semesters. So then when I got to my second year, my course load was pretty light and I was working a lot more, because I wanted to gain that experience. I was trying, especially because I came from working full-time for 3 years before I did my MPH program. Like it was a huge sacrifice for me to stop working full-time to go back to grad school. And I didn't want that gap I didn't want it to feel like I took off 2 years, which is fine for everyone else and whoever decides to do that. For me personally, like I wanted to continue working and not lose like 2 years worth of experience. So I promised myself that the first year I wouldn't work full-time or anywhere near full-time hours, even though that's questionable. But I worked like 25 hours or so when I was a first year, financially, like I had to. And then my second year, I was nearing more like 30 to 40 because my workload was higher. So yeah, I applied for that role and as a team lead, because I knew that I wanted to continue building on my leadership experience and having people reporting to me, and supervising, learning, improving on my supervision skills. And it was a project that was led by the dean of the university that focused on the impact of COVID-19 on Black Americans in New Orleans. So we were focused on improving like messaging around COVID-19, addressing like rumors that would come out, being able to share fact and evidence-based information to the public in a way that was like culturally appropriate and conscious, in gaining information from people's lived experiences. And it was also, I had done monitoring and evaluation work before that, but it really allowed me to like hone in on my monitoring and evaluation skills, because there was a lot of leeway to do whatever I wanted. Like I was the one that came up with the plan and the templates and the logic model, and other things that are very specific to M&E. So I won't throw around more terms, but it just allowed me to like really hone in on my skills, because there was no template for me. There was nothing there. There was no M&E plans. We just knew we had to do it because it's so important to have monitoring and evaluation plans set, and like to continuously monitor and evaluate your project or your program, no matter what industry you're in. It is what will make you the most effective and efficient, both time-wise and cost-wise. So I was really glad that I had the opportunity to lead that work when I was there. And I did it for quite some time and built a lot of relationships and had a big impact during a time where COVID was taking lives away very, very quickly.
Yeah, well, I appreciate you sharing that, and like the perspective of also like front loading your MPH program so that you're able to work more in the second year, and that you're able to like, I guess, more apply a lot of the things that you probably learned in that first year and before into the work, which is like just helpful in speaking to the experiences, as well as I want to highlight the part of you saying that you were doing independent research as a research assistant, which I think people miss, or like people don't understand that that is a possibility. So I just want to highlight that for maybe bachelors or graduate students out there, that that is a potential. Just figure it out. Talk to your professors. Talk to Jesenia. She would help you out.
Independent study. I remember that was one of the things. I mean, it's a course technically, but you don't get paid for doing that. You're
Right.
independent research. So, but it's an opportunity to do independent research while you're supported by a professor. Mm-hmm.
Right. And you were also the co-founder and co-director of Birthing during COVID-19. Do you talk about that a little bit?
Yeah, I can. So because one of my areas of expertise is infectious diseases, I very much tried to serve as much as possible in response to the COVID-19 pandemic. I mean, we hadn't really seen an infectious disease, even epidemic to the degree of COVID-19. I think this is a fact now. In other countries, like in the Dominican Republic, they do have a lot of bouts of infectious diseases. For example, like when I was there, I was working on a dengue outbreak. So there's a lot of epidemics that are happening often because of the climate, this tropical weather, and having to deal with mosquitoes and vector-borne diseases, et cetera, but we don't have that here. So I really wanted to learn as much as possible, and I just felt a calling to help and respond to COVID-19, because this is what I've been working on, and I was specialized in this, and I was an expert in certain areas at that time, and we didn't have enough public health people that could practice. And we're still trying to build our workforce. We did recognize that as like a learning lesson. But anyway, I think that I just learned so much from that experience. I lost my train of thought. Sorry.
You're absolutely fine. No, you don't have to be sorry.
Trying to think about your question. Give me a second. I couldn't remember.
Yeah, just like that experience, like what, because you co-founded it and you co-directed it. So, yeah.
Okay. So specifically with this experience in response to COVID-19, we received funding. There were some grant opportunities. So there was funding available for individuals to come up with a project, a program, anything they wanted, and they could apply for the grant and then execute whatever was written within that grant proposal. So I gathered folks that I knew, aka my friends, formerly my colleagues, that were experts in different areas. And together with my co-founder, who is Kiara Cruz, who's currently a PhD doctoral student at Tulane University, who I know from undergrad, so we go way back. Not the same class year, but still really, really great friends. I reached out to her first and I was like, hey, I want to do this. Are you down? Her expertise is very much in maternal child health. And now I've actually built my expertise as a result of that project in that area as well. But she's been working in this area, got her MPH at Tulane as well, 2 years before I did. And I wanted her expertise there, but I wanted to approach this project from an M&E standpoint. So I worked with her and we drafted a phenomenal proposal. And it was extremely detailed. I mean, we had everything. We thought about everything under the sun because we knew it was competitive. We were applying for a grant for the first time, like for us, for our own project. And we had to think about, how are we going to use this money effectively and efficiently, which was not a large amount in the grand scheme of other grant projects that I had worked on, other grant-funded research projects. This was a community-based project, not a research one, but just for comparison, I was like, how do we make this work? So we thought about all those things, and we came down to thinking about how during COVID-19, birthing individuals were really, really suffering with the detrimental impacts of COVID-19. So just the fact that you couldn't even have your partner in the room with you and you had to give birth by yourself. And then when we start to talk about, maternal maternal and child health outcomes, and we think about the disparities that exist when we talk about race and ethnicity. And I think now a lot of folks are learning about how Black birthing individuals have dramatically higher rates of mortality and like morbidity when compared to white folks. I mean, and New Orleans had one of the worst rates in the entire country. We were like, all right, this is what we have to respond to. In all the work that I was doing and I was learning about, this was one area that wasn't being addressed. So we came up with a project that would provide support for birthing individuals, specifically Black and Brown birthing individuals in New Orleans. And we thought about everything. We connected with providers at hospitals because one of our team members was a medical student, like in training and whatnot, and had connections to hospitals and clinics. We worked with some of the community organizations that we had like worked at or like had some sort of connection. We then built a community advisory board through those connections so that we had folks that would give us feedback, and we had birthing individuals on that community advisory board as well, because you have to center the experience of the target population that you're serving. Like, you can't assume what they want. I think that's really important in any work you're doing. So we made sure to do that. And we just got a lot of buy-in. We got buy-in from the local Department of Health, and we had calls with them. And ultimately what we did is that we built a toolkit that provided information for birthing individuals about anything and everything that could impact their birthing experience. So we provided like information about what is a doula, what is a doula and how can they help you? What is a midwife? What are signs of COVID-19, like in your children or in yourself? What are some signs for postpartum depression? Where can you reach out for help? Here's a inventory of resources where you could find like other birthing groups, like just in the local, like to talk with other people that are experiencing this or have gone through birth. Anything, abortion services, like everything we could think of that could affect it, we included it in this toolkit that we developed. And it was really intentional. The toolkit itself even had like images of people of color, like the language that was used, we made sure that it was read by the people we were serving. Like, do we have too much jargon? Is it complicated? You know, like let us know. Are we doing too much, in the sense like is too much evidence wordy, or more pictures? Like, what can we do? Are we thinking about the language level in this community, the educational level that they have? It was honestly like a project that I'm extremely proud of. We had this toolkit, but we also worked with an organization that we partnered with, and we paid for folks to become birthing navigators, so community birth workers, and they were then trained on our toolkit that we offered. And anyone who went to their to the center for intake, so they provided support services like beyond birth, like social support services. They were told about our program and our project, and they were offered our toolkit, and then that community birthing navigator could then help them to link them to services. Like, do you know where to go? Do you know where to reach out to? It's so important, because that part for people of color is missing, because we don't have the network. We don't know where to go, or maybe they don't know how to use a computer. I mean, there's so many things. So we thought about everything, and we just tried to approach it from a very holistic, like using a holistic model. And that's where like the logic model came in, because with the logic model, you think about like what resources you have available, both people and like physical resources, short-term, medium-term, and long-term goals. And I'm really proud of the impact we had. We were able to really serve many lives through that project.
Love it. And thank you for sharing like the progression and the entire thought process of everything. I feel like if someone was thinking about doing a community-based project, they have a lot of the tips and ideas in that story and that narrative that you shared. So we appreciate that a lot.
Yeah.
And congrats to you and your colleague for like coming together, working this out, and like being competitive in this grant process while you're in grad school, which is awesome in itself.
Yeah, and I just wanted to quickly mention, like, we took this opportunity to like even present at conferences. So we took our work, drafted it up, submitted it, and we were accepted. So if anyone is interested, they can look up birthing during COVID-19, an emergency response to COVID-19 for birthing individuals, and see how we were able to present about that, and definitely do the same thing and serve your community in whatever way you think is important, and that you're capable of doing, that you have the capacity to do.
Absolutely. And just to highlight the point of like having that community advisory board and having people who are with lived experience being a part of this and informing like how y'all are thinking about this, because they are the ones, or they are the peers of the people that are going to be needing these resources, and having their perspective and insights on it is important. So
Yes.
And there are so many ways that you can like take things that you're doing and like turn it into ways to present at conferences, and just share your research and get your name out there, and like build your network in a lot of different that. And then I want you to talk a little bit about, because you mentioned a lot of the jargon around monitoring and evaluation. So talk a little bit about the monitoring and evaluation certificate that you got, and like the value that you got out of that.
Yes. So with that class, with the certificate, I took several classes that were focused in monitoring and evaluation. So M&E courses themselves. And a lot of the times you're looking at programs and you're identifying ways to assess whatever activities they have set forth. Even with my clients, sometimes they get confused with the technicalities of like, what is M&E, and like, what role do you play, and how does that differentiate yourself from the activity? So I'll give an example of something I did recently that I think is easy to understand for one of my clients. So they were hosting a marketing workshop for doulas, and they wanted to learn more information about the people that were going to attend, and maybe learn about, how did the workshop resonate with them. So I proposed that we develop pre and post surveys so we can assess their education, or like their experience, their beliefs, knowledge, attitudes before the workshop. And then afterwards, we can ask questions that are specific to the content and also assess for those changes. So my role in that sense was to come up with these questions, propose them to my client, see if they had anything else they wanted to add, and then add in other things that for me would be important for the evaluation process. So I wanted to get like basic demographics. I also wanted to ask about barriers and challenges that folks were facing just in general, and a few other factors. So just thinking, it's the easiest thing I can say is like, you're taking a step back and you're looking at the overall picture. So she's really focused on like, what am I going to present about, and like basically that, I would say, for the most part, like, I need to keep engaged and blah blah blah, versus I'm not dictating what content she wants to discuss with them. So I'm not involved in the activity development itself. I can consult her on that, but that's not necessarily my role from an M&E perspective. It's more so, given that this is your goal, how can I help you to measure the effectiveness of this, to measure if this was efficient for them, for you, how you can replicate this. Is it sustainable? How do we measure that it's sustainable? All of that. Is it replicable? How do we make it replicable? So there's a lot of factors that come into play. I remember even things as minor as like, we need to collect their email if you would like to have them join other workshops in the future. And we can track their progress over time. So things like that. That's like a really simple version of how I can talk about M&E. And then I can say that even with the I created those surveys, but then I have to create indicators, and I have to refer to like the program logic model, and like make sure that everything is connected, that all the goals that were set from our funders for that project, that we're meeting all of those expectations. Maybe there's an expectation that 100 people participate in these workshops. Are we on track for that? Are we seeing that there's a drop off between people that sign up or not? So I look at like social media metrics as well, and I create like M&E plans for that too. So there's a bunch of different ways that M&E can be applied. And actually in that project in grad school, that was the first time I did M&E on social media. So I'm really well versed on like website M&E and social media M&E, and being able to improve processes of posts and whatnot to enhance engagement. So it's really cool. It's really interesting. I'm very much into tech, and like health tech. So I'm appreciative that I get to play in that space.
Yeah, awesome. Well, and yeah, I love that. And I feel like too many people or too many organizations out there do not think about what is the monitoring and evaluation that's going to take place. And I think like having that as part of the build out of the program is just so helpful in you structuring it in a way that you are going to more likely to hit those goals and achieve what you're trying to achieve and be able to measure that progress. So yeah, and we could probably have you back on some other time to talk more deeply about M&E and maybe like social media M&E, website M&E type of stuff as well. Okay, so you're the founder and CEO of Cosmica Consulting LLC, a strategic healthcare strategy firm serving as an operations expert, monitoring and evaluation specialist, and business consultant, delivering high-impact solutions for organizations, business professionals, and entrepreneurs. So you started this in 2018. How did this come into being, and like what was that initial like start look like for you?
Yeah, so I mentioned that I love to travel. Everything's connected. So I took my first official like solo backpacking trip the summer of 2018 before I started graduate school, and I backpacked through all of Central America. At one point, some of my friends met up with me, but I was by myself for a portion of that, and I couldn't work because I worked in person at the time. So I did end my job right before I left, so I could have this time to myself to just reset and prepare for graduate school, which is not an easy experience. It's challenging but very rewarding. So I wanted to make money while I was traveling. I needed to make money while I was traveling and wanted to as well. And I was consulting folks like friends or friends of friends in career consulting. So anything that had to do with career. So I would write resumes and cover letters and prep people for interviews. And it just came really easy to me. It's actually a random fact. Like when I was in undergrad, I basically like lived at the career center. And I would go there all the time. And I was just very adamant about like, is my resume up to date? And like practicing, I would do like mock interviews when I was there. And anytime I applied for an experience, like I often frequented the career center or like just spent so much time online, like learning, hearing folks. And I became an expert over time in career consulting. So I decided to start Cosmica Consulting as a career consulting opportunity so I can have clients while I was abroad and still sustain myself. So that's what I did. So I would be on the beach and like working and editing people's resumes, and it comes really easy to me. I very much enjoy it, like working on it. It's definitely hard for myself. I'm not gonna front and pretend like it's like comes so easy for me, like when I have to edit my own resume, but it's like light work, and it's like water when I work on it for other people. I don't know why. I think it's because it's easier to step away. Like I mentioned, the whole M&E thing, it kind of comes in with that career stuff. So yeah, that's how it started. But shortly after, I did upkeep with it like during 2018. But then I had to scale back because I was going to grad school and I had a lot on my plate, like courses plus working through the university and for the university. So I just scaled it back. And I kind of just took clients like on an as needed basis, but needed for me. Like, okay, I have the capacity to take on these clients, or I don't. And I definitely scaled back during that time when I was in grad school, so 2018 to 2020. But I also worked on other projects. So I would one of my members that reported to me when I worked at Mount Sinai, she got accepted into, wow, I feel bad that I'm not remembering the program name, but it is a program. It's a federal-based program. It's a 10-month program that you apply for, and you can do research in other countries. If I remember, I'll let you know because it's not coming to me.
Send it to me, and I'll put it in the show notes.
Yeah, I'll definitely put it. And I have another friend that's it. Fulbright. There we go.
Yeah,
Fulbright.
Right.
So she was a part of the Fulbright program, and she had asked me to serve on her board and give her feedback on like research, her research methodology and approaches, especially because when she met me, I was the program manager for that research study. So that's all I did was just making sure that like it was IRB appropriate and that we were meeting all the standards and regulations, that we protected information, PHI. So she wanted me to consult her on that. So I did that as well. And other just research projects, like one-off contracting opportunities. And then last year, I decided like I want to shift more into business consulting because I was doing less career consulting and getting picked up for these contracts or like for these opportunities, like one-off opportunities, like what I just mentioned. And I said, okay, I'll do the career consulting, but I want the majority of my business time to be taken up by business clients because I want to learn from like their approaches and their methods and like how do they run their companies and strategies and whatnot. So it's been a really great experience, and I still have career consulting clients. I think they're really important for me to give back on that one-on-one individual basis. So back to the pre-med days and what drove me to maybe be pre-med once upon a time. But you know, most of my capacity is working with organizations and businesses that are focused on community health or population level health. Mm-hmm.
And for you as an entrepreneur / business owner, what was that shift like moving from consulting around careers to consulting with actual organizations? And what did you learn to be as successful in doing that work?
So, I mean, organizations definitely have a much larger budget than individuals will have. I mean, one individual, it wouldn't be appropriate to charge as much as what organizations may need. So there's that aspect, but I wouldn't say I wasn't doing it for the money. I was doing it for the type of work. Like I really wanted to do M&E work, and with individuals like career consulting, that's not M&E work. It's just another area that I just happen to have expertise in and that I enjoy. But yeah, I guess it's hard. When becoming a business owner is extremely challenging. I mean, I came from a household where my father was a business owner. I didn't really understand that or process that until I was much older, that he had his own business. He worked from my house, like from our apartment. He had a room like dedicated to his workspace. He was a dental technician, had his own clients, did his own business taxes. Like it was like this whole, like he had his own small business and I had no idea. But it made sense to why both my parents were home, like a lot of the time, majority of the time. And I thought about that, like when I decided to pursue my own business was like, well, I grew up with this. This is like what's normal to me. This is what feels comfortable. And this is what I'm good at. And eventually, like, I just want to build a company that looks like me. People of color is what I mean by that. That are very diverse, different backgrounds, different upbringings, different experiences, and that are serving communities of color, and that's their priority, and serving them across all areas of public health, but with that M&E lens and expertise. So my goal is to scale up and hire folks. I'm almost at the point where like I might hire somebody, but we'll see. I usually will outsource like one-off, but we'll see. Fingers crossed. I definitely see it happening. We'll decide on when to pull the trigger, because it's important to recognize when you need help. That's why I want to emphasize with that, and when it's like appropriate to hand off things to someone else who's an expert and maybe better at doing XYZ than what I am, or there are certain skills that I don't have the desire to build, like website designing, which was very difficult when I was working on my website. But it's been a very rewarding experience to be my own, to have my own business and to scale that and grow it, and have clients now that I love working with, honestly. And it diversifies like what I get to do in the public health space. So I'm really thankful for that. And I'm looking forward to continuing to grow my portfolio and give back in that way to my communities.
Yeah. I love the like process of like going into your MPH program, making sure you get this monitoring evaluation certificate, and now you like actually trying it because you realize this is something that I actually like doing, and so let me do it and figure out how to do it. And I think going back to like you starting this consulting company to like just support your livelihood while you're in South America, Central America, backpacking, and then the evolution of that and just seeing what that could become, just saying like, you know, start something, you never know what it can become. And the last thing I'll say here is you heard Jesenia talk about hiring someone. So this is your opportunity to reach out and create those connections, and maybe you will be that person that is hired. I don't know, but that's up to you. Okay, so
I'm looking for a virtual assistant if that helps. That's number one that I need right now.
If you're a virtual assistant, reach out. Information will be below. So you're an epidemiologist / data scientist at the CDC through Chenega Enterprises. How did you come across that, and what do you do in it?
Connections. So I have a good friend from college that I had told that I was looking for a new opportunity, or that knew about me. I'm not sure if she knew that or if she just thought about the fact that I was an epidemiologist by training. But either way, we were catching up and she mentioned it, and she was like, wait, would you be interested in this? Like, you would be a perfect fit. And I was like, yeah, like I would, yeah, definitely. Like, I want to work with the CDC. I just, if the opportunity is there, let's do it. And yeah, that's how I got it. And I spoke with them, and I mean, I loved working at the CDC. It was one of the best experiences ever, especially because I got to work during the COVID-19 pandemic. So there was so much that was brand new for the first time, things that I got to be a part of that had a national and international impact. I mean, it doesn't get any bigger than that for me, who's a futurist and loves making an impact at that population level. It really was like a dream come true to work there. So I work in my data scientist role. A lot of what I was responsible for was serving as the lead data scientist and analyzing data related to COVID-19 to identify the impact of like different strains of COVID-19, and provide suggestions and recommendations to different health centers on how they can improve their practices, so like their infection prevention practices, as well as response for vulnerable populations that were affected by COVID-19. So it was incredible work because it was real time, like impact, which was something that I was looking for, was like, can I work in infectious diseases and like see the impact like soon? I know that there's like instant gratification, but it wasn't that. I mean, sometimes you just don't see it for like 10 years. So I was like, can I get it in 5? So that was it was a really, really rewarding job. It was difficult, of course, because of societal pressures and whatnot. We all know what was going on during COVID-19, especially working at that organization. But it was, I mean, phenomenal work was happening all around, and I'm very proud of the fact that I was there, and that, you know, we kept trying to be a great resource for the public at large. Mm-hmm.
Yeah, well, thank you for sharing that. And that definitely is an awesome opportunity, especially if you're an epidemiologist during the pandemic. I think that is in itself like probably what you've been waiting for, like in a kind of a morbid, sad but exciting way, like that. Mm-hmm. This is what you've been waiting for, to do this kind of work. And just so those people that aren't aware, Chenega Enterprises is like one of those consulting companies that contracts with the CDC to do public health work. So I think there are a few big ones out there that do that.
There are other government contracting agencies that especially hire a lot of folks to assist when we need, when there's like an emergency response, or there's just a need for public health employees. But just regularly, they do hire folks as government contractors, versus when you work directly for the CDC, then you would be an FTE, and you can look further into that. But I do want to preface with the fact that, like, if you're a government contractor, you're not any different, in the sense that you're not treated differently for not being an FTE, which I really appreciated. Like, I was valued as much as other folks that were hired, like, directly as a direct hire with the CDC. Like, in that capacity, in that standpoint, you're the same. And I very much appreciated that, because I was a little worried at first. But yeah, it was a really great opportunity.
Yeah, definitely. Mm-hmm. A fair worry. a fair worry, something that is fair to worry about.
Yeah.
Yeah, shout out to you for being able to do that and for supporting the work during the COVID-19 pandemic. We appreciate you. Um, and you currently work as a health policy manager at a policy center. So you can tell us a little bit more about how you got into this role and what you do.
Yeah. So I think in my working as a data scientist, like I was extremely grateful that I got to learn SAS. Well, I hadn't learned SAS in grad school and used it in one of my jobs as a research assistant. So I was familiar with it and had experience with it, although I was more of an expert in Stata. That's another statistical programming software. So I learned to adapt, and then I learned all the advanced stuff that I had been very like well versed in Stata and SAS. So that was awesome. And then I had a friend that told me about this policy center that was expanding and looking for folks that were interested or that worked in like related to health policy. And I had a very strong interest in policy because I felt like that was an area in public health where you can have such a big impact. Impact is really important to me if that hasn't come across yet. And in that, I wanted to have the opportunity to be in a role where I could influence policy more directly. And when that opportunity came up, I was like, yeah, let me try this out because I think that this would really help me to almost like finish off circling the experiences that I had. So I'm really thankful that I've worked in different spaces with, multiple sectors, public, private, at the local, community, state, national, international level, in clinical research and public research, on different chronic conditions, on different infectious diseases. Like I've just tried to diversify myself so much and been very intentional about that and wanted to have more of that policy, like hone in on that policy experience. So when my friend relayed that information to me and then recommended me, I mean, from there, this is where I am now.
Right. And shout out to like that the part about like networking, and I
Yes.
think like the
All
also,
networking.
it is in a lot of senses, and then the other part on like the intersectionality or like just being able to tap into different parts of the public health work and working in different ways, and how that probably helps you be a more holistic public health professional, which I think is also important.
And I came in with like a very diverse perspective compared to my colleagues. Given that I had so much practical public health experience, and I do have a lot of colleagues that come from an academia background. So it's really beneficial to have this diverse experience and realize like, wow, I'm adding so much value to space because I've worked in these different spaces that they maybe haven't or don't have as much experience in. And I can see the value that they have working in academia, especially being at a research-based policy center. And I wanted to mention, I think, but between the time that you and I spoke and like agreeing to do the interview, since then, I've been accepted into the Rockwood Fellowship, specifically for prenatal to 3 leaders. And that's the space that I work on. I work with specifically on child health policies that affect early childhood development. So I'm really excited to be a part of this fellowship, and I actually leave this weekend to California, and I'm going to an in-person retreat with the Rockwood Fellowship, with this specific Rockwood Fellowship. They have multiple fellowships available, so highly recommend everybody look them up. Rockwood, ROCKWOOD. They're a phenomenally conscious organization. For example, my cohort, they were aiming for like 80% people of color to make up the cohort. And that was like, that resonated with me so much when I had my interview and whatnot. I just saw how they were aware of like biases and just expressing some sort of consciousness towards that goes far beyond than not. So I very much am so excited to like be with them and learn from other leaders. And I wanted to share this because I was interested in continuing to build my expertise in policy. So I have working in the space, but I also wanted to connect with other folks and like network, like how do I learn from them? I work in a remote environment, so it's not as easy to meet folks like in my everyday life that are in this space. And even though I connect with other organizations through my policy center, it's not the same than when you're in person. So I'm always looking for opportunities. So when I found out about this, I was like, yeah, I definitely need to do that. I want to get in. Did the whole preparation process that I do, like when I do for my career clients, it's like applying for a job. It's really, really competitive. And yeah, and then now I'm here. So I'm really, really excited to be a part of that in-person training retreat that provides a lot of leadership guidance and support.
Yeah, well, congrats to you once again. Shout out to you, and I'll definitely link information to that below for anyone that is interested. Yeah. And I look forward to like hearing more about that and learning more about that and seeing like what that does for your trajectory of your career and where it takes you and the learnings and just everything like that. Which is awesome. You're most welcome. And before we get into the Furious Five, I would like to ask you, where would you like to see yourself in the future? It doesn't have to be a specific position unless you have a specific position in mind. But yeah, feel free to share what your futurist mind is thinking at this moment.
Yeah, my determination always keeps me busy. I see myself scaling my business for sure. I want to be able to grow my portfolio and work with a lot more business clients. I also want to scale my career consulting. So currently I have a Cosmica support group that I run every Sunday and with a small group. And it's kept that way just at the moment to build and foster like relationships and support. And we meet for an hour. And during that hour, we do like a working session. We reflect on that working session, which provides an opportunity for everybody on the call to like network and just to help each other. Maybe two people are working on similar things, or like, and it can be anything. It doesn't always have to be career related. Like some folks decide to work on their budget because it affects their career. And then two folks, I remember one time were like, oh my God, can you give me budget tips? Can we talk after this call? So it's cool to see that like everything's connected. I don't think that we live in like a personal silo and then your job silo. And then after like everything is connected. And hopefully everything you're doing really feeds into that joy and your overall happiness. But so I do that and I want to scale it. And right now I'm planning to start a second group because I have a lot of interest for that and just want to scale in that way. Like, how do I give back on this individual, like group basis now? So those are goals. And then I do want to continue working in like the spaces that I'm in now. So in policy and international health, I've had like one opportunity come up to like volunteer. So I'm hoping I can dive into that. And I think volunteering is important. Like right now I serve on another board where I review applications for travel, like scholarship, for offering scholarships for travel. So I'm really excited to like be doing that and giving back in that way. But yeah, I think long-term is just making an impact like at that population level, ideally internationally. So I want to be working with really large organizations like the WHO. Whether I'm working directly for them or not, it's fine, but more so just working with organizations that are trying to make an international impact and then still like domestically as well in different capacities. But growing my learning in monitoring and evaluation at that level would be phenomenal. And I know I'll do it. It's just a matter of like, when will it happen? I don't know.
Yeah. And enjoy the journey. We look forward to seeing all that growth and all what this life and the world of public health has for you. Thank you. You're welcome. And just for people, once again, Jesenia just said that she is trying to scale up her business. So reach out if you're interested in networking around that.
Truly. It might happen sooner than I thought. I mean, I saw, I set my goals out much further out, but yeah, I reach out. If you're good, then I'll move forward with you.
Yeah, absolutely. That was your third invitation, so don't miss out on the opportunity. Awesome. And if you do want to share that group mentorship program, the second cohort that you're going to unleash with me, I will share it with my people if they're interested.
Yes, I can share the form that I have for folks to sign up and express their interest, and I can send more information to that group for sure.
Yeah, let's definitely do that, because opportunities and mentorship and networks are important, as we've learned today. Yeah.
Yes.
So moving on to the Furious Five, the 5 questions I ask all guests. Number one, and I guess this is a question you probably get a lot. What advice would you give to a student trying to pursue a career in public health?
So I just spoke to my mentee this past week, one of my mentees, and I'll say exactly what I told her. Get really clear about what it is that you see yourself doing in the future and work backwards and assess like the multiple routes that you can take. So for her, she was trying to figure out, should I go to grad school right now? Should I get a job? Should I do both? Should I not? And I told her to consider all aspects, like what impact would it have on your personal life if you did both at the same time? Are you financially capable of paying for full-time graduate school, or would part-time be better? Does your job offer tuition reimbursement? Does it not? Or does the job that you're looking for offer that? Does it not? Do you have to be there for a year before you can get tuition reimbursement? Like just thinking about all the different options, but we've set up a plan, which I do. I use the same approach that I use with my career clients with her, and she's going to be prepared to approach whichever option she has, and she's kind of working towards both, and then ultimately she'll make her decision. But I really think that thinking like long-term and working backwards really helps. And just checking in like every so often, like, do those goals that I have still align with who I am today? Because sometimes they change. Like I was pre-med and I wanted to become an emergency medical doctor that was specialized in infectious disease, and now I'm a public health, practitioner that specializes in infectious diseases. So you never know if it shifts, even if it's a little bit.
All right, love that. Set your goal, work backwards, and figure it out. There are many paths in public health to get to where you want to go.
Yes.
Yeah. Number two, if you're talking to someone wanting to get into your position, both as a CEO of your organization and as a health policy analyst manager.
Yes.
Yeah. What advice would you give them?
For the business, I would say become very clear about what it is that you believe you're meant to do in terms of service. Like, who are you meant to serve? And how are you meant to serve? And I think when you think about that, think about what are you good at and what do you want to get better at? And one way to figure that out is when you're doing XYZ, do you lose track of time and you don't care that you lost track of time and like you enjoy it, even if it's hard? Usually those things are like aligned with what you're meant to be doing and serving other people in. And then in terms of becoming a policy manager, definitely gaining leadership experience. So experience supervising folks is important for any management role. And a lot of what I do is project management as well. So being extremely organized is important. Learning different tools, how to use project management tools will be helpful. And of course, knowing about policy and then health and building that expertise in those areas. And honestly, if you can work in a different space that's not public health, but as long as you know how to transfer your skills and talk about the transferring of those skills, you can do it. It's very possible.
Great advice. Number three, what's something you are working on improving in your life right now?
Oh my God, great question. Let me see, what am I going to pick? I'm working on a bunch of things. I guess one fun thing is that I'm working on improving my dance skills. So I go to dance classes. They learn a lot of like choreo, very technical choreo. It's a lot of fun. And then I'm trying to think, I guess in my career space, what is one thing that leads over everything else? Okay, one thing in my career space that I'm trying to learn right now is how to get more buy-in, especially in the policy space, from folks that may have not been as open to policies that they've never passed before, or like that they've pushed back on. So how do I learn to talk to folks that don't agree with like the policy suggestions or recommendations that I might have that could offer like a lot of benefits and opportunities to certain groups of people? And there's a lot of reasons for that. Maybe they don't know how to like obtain funding, or like what funding sources exist, or they don't understand the impact that it could have on closing the gaps, like in inequities. So being able to learn how to communicate that even better with people that are not as open sometimes, or as receptive, or whatever it may be, but just learning like, how do I talk to them from a different perspective? Yeah, that's one thing.
Yeah, well, I look forward to seeing Jesenia, the Chris Brown of public health, out there singing and dancing, as well as I think that's like a very underrated skill of like being able to persuade, quote unquote, someone into understanding the value of this policy and what it means for their constituents or whatever other stakeholders they serve. So yeah, appreciate that and look forward to hearing how you do that. So number 4, professionally, do you recommend anything?
Okay.
Book.
It's hard to say professionally. I would say in general, and even personally, I recommend doing more of what makes you happy.
Love it. Nothing more needs to be said there. we need that push. Appreciate you sharing that. And then last but not least, where can people connect with you?
Yes, so you can connect with me. Best place is on my website, which is cosmica.consulting.com. So that's spelled COSMICA consulting.com.
Awesome. Well, be sure to connect with Jesenia there. I will link that below so that you all can click on that very easily and connect with her. But thank you so much for coming on and sharing your story and sharing your insights. Very, very valuable.
Thank you so much for having me. This has been a great time. And definitely anyone who has any questions or wants to connect, feel free to reach out to me.
Yes, please do that. And yeah, I think we'll be connecting to do some stuff in the future. I will let you know about that. But anyway, yes. Housekeeping items. Yeah. You're for it? Awesome.
Yeah.
Awesome. Love it. So housekeeping items, everyone. Thank you so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a 5-star review and share it with a friend. It only takes like a minute to do, so be sure to do that. Greatly appreciate you all. See you all next week. Peace.